Financial Planning, Medicare Choices for Federal Retirees and Veterans by Gary Floring. Medicare began in 1965 as a government health insurance program to assist senior citizens with medical services and treatment. The program pays for approximately 80% of medical bills for those 65 and over and individuals under 65 with certain disabilities. Federal government employees and retirees and/or military veterans have their own separate health insurance programs, which cover more than Medicare. The civilian program is the federal employees health benefits program. Veterans under 65 without Medicare have TRICARE, and veterans over 65 enrolled in Medicare Parts A and B are eligible for TRICARE for life. Healthcare options. While TFL requires veterans 65 and over to be enrolled into Medicare A and B, enrollment is optional for federal civilian retirees. Since FEHB provides very generous, comprehensive health insurance, the question arises, why should retirees enroll in Medicare if their FEHB coverage is so much better? Two major reasons. One, social programming, and two, coordination of Medicare with FEHB plans. Social programming refers to expectations at certain milestone ages. For example, at 16, we are expected to begin driving. At 21, go out for our first official drink at a pub. At 62, apply for Social Security. And at 65, apply for Medicare. Thus, many federal retirees enroll into Medicare Part B automatically, even though their FEHB plans cover more than Medicare A and B combined. Dual coverage. However, this results in duplicative or overlapping coverage with two monthly premiums, $165 for Part B and another one for their FEHB. Retirees usually enroll into Part A because the premium is $0 if they paid into Medicare taxes for 40 quarters, which is 10 years. So the decision becomes to be or not to be. Next, let's discuss pros and cons of enrolling into Part B for federal retirees and how veterans with TRICARE and TFL are affected. FEHB and Medicare. Enrollment in both results in two separate premiums for overlapping health insurance. In fact, approximately 25% of all federal retirees have declined Part B for this reason. FEHB carriers recognize this catch-22 and have recently developed health insurance plans to offset for this. For example, some plans now offer Part B annual rebates as high as $1,800 to help offset the $1,980 annual cost of Part B. In addition, when a beneficiary has both FEHB and Part B, many plans eliminate all deductibles, which is upfront out-of-pocket cost, co-pays, fixed amount, and co-insurance, a percentage of the bill, for any medical services and treatments. These benefits reduce the impact of paying two premiums for overlapping coverage. Medicare Advantage Part C. However, the recent introduction of low-cost benefit-rich Medicare Advantage Part C plans adds another complexity to the already confusing maze of FEHB TRICARE, TFL, Part A, Part B, Part D, premium rebates, etc. Part C plans are now widely available with $0 per month premiums and may include generous benefits such as prescription drug coverage, dental and visual coverage, over-the-counter allowances, free gym memberships, Meals on Wheels, and etc. For 2023, some plans have introduced partial B monthly rebates as high as $65 in Kitsap County to reduce the $165 Part B premium. FEHB and/or Part C. With Part C plans now so affordable and offering such comprehensive benefits, federal retirees, their survivor annuitants, and former spouse annuitants have the option to suspend their FEHB plans and premiums indefinitely and enroll into another health insurance plan. If they enroll in Parts A and B, they can substitute FEHB with a Part C plan for their medical insurance and prescription drug coverage, plus receive benefits listed in the previous paragraph. This option works best for those enrolled under FEHB as self-only and want to minimize monthly budget expenditures. It is also an option for saving money if enrolled as self plus one, with their dependent also enrolled in parts A and B, and thus eligible for a separate Part C plan. Suspension of FEHB still allows enrollment and retention of a separate federal dental insurance plan on top of Part C plans. Many retirees opt to retain their FEHB plan for medical and prescription coverage and enroll into a $0 per month Part C plan just to claim non-medical RX benefits such as dental, vision, free gym memberships, and Part B premium rebates and generous over-the-counter allowances. Other insurance choices. FEHB enrollees can also suspend their plan if they are eligible for TRICARE and TFL deployed by the Peace Corps or eligible for the Civilian Health and Medical Program of the Department of Veterans Affairs. The Office of Personnel Management allows indefinite suspension of FEHB using Form RI 799. Enrollees who suspend their FEHB may re-enroll only during open enrollment season, November through December, or within 30 days of any life-changing event, loss or gain of other medical coverage, relocation, birth or death, marriage, or divorce. Options for veterans. Veterans 65 and over who are covered by TFL must enroll in Parts A and B. This adds a $165 monthly premium to their budget. Unless they have a disability, most TRICARE TFL veterans may pay separate premiums for federal, dental, and/or vision insurance plans. Although a Part C plan may offset some of these costs and more at a lower overall cost, since prescription drugs are usually covered at a low or no cost for veterans, they can enroll into a non-prescription Part C plan at a $0 premium to obtain benefits such as basic dental coverage, vision, over-the-counter allowances, free gym memberships, etc. Veterans can still enroll into or retain a separate federal dental insurance plan in addition to their TRICARE TFL coverage and Medicare Part C plan. Comparative analysis. The accompanying chart illustrates a quick cost comparison to help decide which option may be best for your individual situation. These represent 4 actual FEHB plans for 2023. Gary Floring, Medicare 101 professional.